I'm going to demonstrate a method of brushing today that is usually not taught by other dentists. Usually they recommend what's called a 45-degree method. And I personally have found that it is much more efficient for patients in the brushing of their teeth, in the cleaning of the teeth, and of the gum and the gum line where the plaque and the tartar hide, is actually a method that would be called a 90-degree, right up on the teeth, which I'm going to demonstrate to you. But first I'm going to mention the toothbrush. You should always have a soft, what's called technically soft. They sell soft, medium, and hard. Buy only soft brushes, but the bristles have to be straight. Once the bristles go crooked, as we have in that cartoon that will show you, then the toothbrush is garbage. Toothbrush can last a month or two the maximum, and it's worth the investment to have a brush that's going to work, because once the bristles get weak, and the soft brushes will get weaker faster than the medium or hard brushes, but the soft brushes will never do damage to the gum. They will never do damage to the enamel. The medium and the hard brushes can do damage potentially to the gum tissue and sometimes even to the enamel. So that's why you always use a soft, and make the investment of replacing them as soon as they don't stand perfectly straight. I'll demonstrate here on the model, putting the brush directly on the teeth so that, if you can get this, the upper row of the toothbrush is right at the gum line. And we're putting it right on the teeth and pressing. It's very important not to move the brush too fast. Most people brush like this. They go zooming with the brush, and I call that flying without a pilot's license. And what they should do is just put the toothbrush right against the teeth, press and wiggle in one spot. And you can see the top row is digging into the gum line. It naturally bends into the gum line. So I find that more effective than the 45-degree angle, which would do this, but wouldn't really brush the teeth very well, because if you look at the 45-degree angle, the teeth are not getting brushed. The teeth are getting the side, maybe the side of the brush. We want the brush to go right on the teeth, like this, and 1, 2, 3, 4, pressing, wiggling in one spot. Next spot. 1, 2, 3, 4, pressing and wiggling. Just put it right on the teeth, right up to and touching the gum line, not over the gum line. We don't want to go up on the gum line. We want to go up to the gum line, pressing and wiggling. We want to go right on the teeth, on the biting surfaces. We want to do the same thing on the inside surfaces, which is straight on the teeth, pressing and wiggling up to and touching the gum line. The only difference is behind the front teeth. And this is a model of the top teeth, the same thing the bottom teeth. You turn the brush now to what we call an up and down position. And what you do is up and down, one at a time. This is the only way to get behind the front teeth. Because of the curvature, it's not going to be very good. You can see the space there. You can't really brush very good if you take the brush sideways. So you have to go up and down, one at a time. Again, slowly pressing and wiggling up to and touching the gum line. Slowly pressing and wiggling. Again, if you go like this or you start zooming around, you will not be very effective. So it's sideways, every place. Hold it, pressing and wiggling up to the gum line, up and down behind the front teeth. Very important, slowly pressing, not flying. Again, I'll mention the tooth bristles must be straight up and down. Once you see that the bristles are going like sideways, when you're just putting it down, not while you're using it, but just when you're finished using it, they're standing like this to the side. It's a sign you got to get another brush. Don't be stingy about that, because your teeth are much more important than the dollar on a toothbrush. I really hope you enjoyed this demonstration and really learn how to take care of your teeth. You'll see a major difference. Your gums will get pink. Any redness or any swelling will go down. You may have some bleeding in the beginning if your teeth and your gums are not being used to direct massaging, direct cleaning. That's normal. Should go away in about a week. Don't worry about some bleeding or some irritation in the beginning. As long as you're using a soft brush carefully the way I showed you, you'll find that it'll get better and better. We also do antibiotic cleaning when we clean the teeth with antibiotic flushing, which will definitely help for gum infections. We do conservative periodontal treatment, and that involves a lot more than I can tell you on this video, but we'll be happy to take care of anyone who would like to avail themselves of this conservative treatment. I recommend very highly before you go to have any kind of gum surgery. So have a great, bright, smiley day.